So, talking about oral glucocorticoid sparing effect of mepalizumab in eosinophilic asthma. In intro, we had that asthma is a common chronic inflammatory disease of the airways that affects 5 to 10% of adults and children. Although the disease is well controlled in inhaled therapy, most patients, approximately 10%, have severe asthma that is associated with substantial morbidity, mortality, and economic effects. Current treatments with glucocorticoid sparing properties are not recommended in patients with severe asthma. So the mepalizumab is a humanized monoclonal antibody that binds to and inactivates interleukin-5, a cytokine that recruits eosinophilics from the bone marrow and promotes the persistence and activations of these cells. Here we have a video about asthma. I'm gonna skip it. And a bit about how does asthma works. I'm gonna skip it too. Well, in the study design, multicenter randomized placebo-controlled double-blind parallel group study consists of 4 phases: optimization of the oral glucocorticoid regimen, induction, reduction in the oral glucocorticoid dose, and maintenance. Well, the patients for this trial, eligible patients, had at least 6-month history of maintenance treatment with systemic glucocorticoids before entering the study. The presence of eosinophilic inflammations was determined by the blood eosinophil level of either 300 cells or more per milliliter during the 12-month period before screening of 150 cells or more per milliliter during the optimization phase. For the assessments, a clinical significant exacerbation was defined as a worsening of asthma leading to the doubling or of the existing maintenance dose of oral glucocorticoids for 3 or more days, or hospital admission or an emergency department visit for asthma treatment. Here we have a video about asthma exacerbation. I'm going to skip it. Well, the efficacy outcomes, the primary efficacy outcome was the percentage reduction in the daily oral glucocorticoid dose during weeks 20 to 24 as compared with the dose determined during the optimization phase on the basis of using the following categories: 90 to 100% reduction, 75 to less than 90% reduction, 50 to less than 75 reduction, or more than 0 to less than 50% oxygen reduction. Well, the trial results. In the specified primary outcome, more patients in the mepalizumab group than in the placebo group had a reduction of 90 to 100% in the oral glucocorticoid dose and a reduction of 70 to less than 90% in the placebo group. So this means that the group of mepalizumab was more effective than the placebo group. The safety, the incidence of non-asthma related adverse events that 80% in the mepalizumab group and 91% in the placebo group. The most frequently reported adverse events in the 2 study groups were headache and nasopharyngitis. Here we have a video about the nasopharyngitis, and I'm gonna skip it. And in the conclusion, we have that among patients with severe eosinophilic asthma in whom dose of oral glucocorticoids have been reduced as much as possible before starting steroid treatment, those who received subcutaneous mepalizumab had significantly greater reductions in the maintenance oral glucocorticoid dose than did those receiving placebo. Mepalizumab also has had a significantly beneficial effect on exacerbations, asthma control, and quality of life, even though patients had a clinically relevant reduction in the dose of oral glucocorticoids. And here's the mechanism of action of the mepalizumab named Nucala. I'm going to skip it. Thank you.